right, so now October is Breast Cancer Awareness Month, an annual campaign aimed at increasing awareness of the disease. And it's also a call to action for everyone to reassess and take a look at their lifestyle and evaluate their cancer risk. Now, luckily for us, we have Dr. Darren Green to help us out with some health hacks this morning. Great to have you here, as always. Of course, October being Breast Cancer Awareness Month. So let's quickly start with what we put in, because usually that's where you should start. Everything, the body works from the outside or from the inside out.
Good point.
So let's talk about our diet and what it is that we can do to live a healthier lifestyle and thus reduce our risks of developing cancer.
I think a lot of people don't know that certain foodstuffs actually cause inflammation in the body.
Yes.
And remember that the pre-runner to cancer, obviously, is when you put a lot of the cells under stress or under strain, and then they start multiplying at uncontrollable rates, forming then tumors or masses and so forth. So inflammation and food that doesn't cause inflammation is very important. For that, we need to look at your genetic risk of things as well, but also looking at a good balanced diet in terms of your vitamins, minerals and supplements, etc. So the nutrition plays a massive role in triggering those cancer genes or not, combined with environmental factors and a whole lot of other lifestyle factors like smoking, alcohol, sedentary lifestyle. But nutrition-wise, certainly a lot of micronutrients, macronutrients and vitamins.
Would you say from a diet point of view, I'm looking at this wonderful picture over here, that the more natural you go, the lesser your chances of developing cancer?
Yes, the less that food has been processed and altered from its natural form, the better it is for you. Because the processes that actually change the structure of the food, just take cane sugar, for example, as one of them. The refined process and processed meats, for example, and the link of all that to an increased risk of developing inflammation in the body and cancer, those are things we don't doubt anymore.
Okay. All right, so that's what we can do from an internalizing point of view. What about from an outside point of view? You talked about sedentary lifestyle.
Yes, certainly. So obviously exercise is a major contributor to reducing your risk for many types of cancer. And with that obviously comes good decisions and boundary setting in terms of your sleeping pattern and in terms of the company you keep. Surrounding yourself, obviously, with people that are in the same mindset and belief system as well. It's easier having a braai with people that eat what you're eating with them than having people that just want the braai broodjie. Exactly.
Okay, so making sure of that. And of course, when we talk about skin cancer from an external point of view, making sure that if you're, especially on a day like this, and you're going to be going out with the family, taking care of your skin and putting on the sunscreen. Don't leave that behind.
Yeah, people forget. So putting the skin under tremendous stress without that UVA and B protection of sunscreen is also puts you at great risk. Remember, in these times of the year, people love spending hours in the sun. And you need to reapply the layers of sunscreen. So, you know, when they say factor 50 or factor 30, for example, you are 30 times less likely to burn if you apply it, but you need to apply it, especially with water sports, every hour or two.
So every hour or two, reapply again?
Especially if you're out swimming and doing water sports.
Okay, great advice. And then also, what about screenings? Health screenings, annual health screenings, how do those help reduce your chances of...
So prevention being better than cure. Early detection for most cancers is absolutely essential for us in giving you a normal life. I mean, that's why we do things like pap smears for human papillomavirus and cervix cancer. That's why we advocate prostate screenings with the PSA hormone levels and your prostate to be checked as males. Testicular examinations monthly. The breast examination, that should happen monthly as well. Essential to pick up early abnormalities in the tissue.
Sure. Should you be like booking a whole week out of your year just for those annual screenings to make sure that you get them done?
Yeah, well, some of those you can do or your partner can do, but the blood stuff, you need to obviously see the doctor and book an appointment, like, you know, an annual appointment to do your cholesterol, your sugar checks, your blood pressure checks. Absolutely fantastic.
Yeah, well, it might sound like a lot of admin, but hey, your life depends on it,
100%.
Right? Thank you very much, Dr. Darren Green, for these great Be Well health hacks, and of course, helping us all lower our risk of cancer.